Hello, Danny Blyth looking at 8 principles in TCM. Please pause and read. Remember, this is for acupuncture students only. Bar is 8. It shows separation or division, with 8 being the number of division in heaven. So, for example, we have the 8 winds. And Gang is the outline or guiding principle. So it shows threads and a net, so it's like the head rope of a fishing net. So the 8 principles or 8 guiding principles. These 8 principles are all in yin-yang pairs. So the first is yin and yang, the second exterior and interior, biao and li. The third is empty and full, shu and shi, or sometimes called vacuity and repletion. And the fourth pair is cold and heat, han and ru. Yin and yang give us the essence of the other principles, and we use them for yin and yang deficiency and collapse. Interior and exterior tells us where the disease is located, note where it's located and not where it originated from. Full and empty gives us the strength of the zheng qi versus the xie qi, the strength of our upright qi versus how strong the pathogen is. And hot and cold gives us the nature or the qi of the disease. And these are general guiding principles. Can be one or the other, or a mixture or neither. It gives us the overriding principles of diagnosis and the overriding principles of treatment. For example, if something is exterior, then we vent it. If it's interior, then we'll tonify it or clear it, depending on whether it's full or empty. If something is full, then we will clear it or drain it. If something is empty, we'll nourish or tonify it. If something's hot, then we'll cool it. If something's cold, then we'll warm it. If you get the 8 principles right, then your treatment won't be too far off. You won't do any harm. You might not be exactly right, but you won't be wrong with your treatment. The history of the 8 principles is extremely old, although the phrase itself is relatively new. So back into prehistory myths, Fu Shi, this chap here, holding a very old version of the Tai Chi diagram, was said to have devised the bagua. And these bagua have lines, yang lines and yin lines, making up the 8 trigrams, and this makes up the hexagrams, and hence like binary for understanding the world. Way back in the Shang dynasty, Oracle Bones characters included Zheng and Xie for upright and evil. Also the character of Qi. In the spring and autumn annals, yin and yang were discussed in relation to medicine. The 6 external causes of disease were also discussed, although slightly different ones from the ones we know well. In the Warring States period, where a lot of Chinese philosophy comes from, full and empty were used in military strategy. During the Han Dynasty, this stuff was all very much used in medicine. So in the Suwen, we have yin and yang, internal, external, full and empty, and hot and cold, but they weren't yet grouped together as the 8 principles. Chuan Yu's case histories used hot and cold to diagnose, and the Shanghan Lun, the discussion of cold diseases, was definitely used the 8 principles to diagnose, especially in external, internal, and full and empty. In the Song dynasty, we had full and empty, cold and heat, and internal and external. Ko Zong Shi called these the 8 necessities, and he matched them up with Zheng and Xie, upright and pathogenic qi. Zhuan Yansu also used these 8 necessities, but he included Ben and Biao, root and branch, instead of Zheng and Xie. Zheng Jingyue in the Ming dynasty talked about the 6 transmutations, which were again these same 6. It wasn't until the Qing dynasty and Xu Danchun, who was very much a traditionalist, talked about the 2 principles, i.e. yin and yang, and the 6 necessities, and this is our current 8 principles. The actual term itself wasn't coined until 1947 with Zhu Weiju, who was writing a discussion on the Shanghan Lun, and this was shortly before the birth of TCM as we know it. So yin shows a hill and the presence of clouds, so it's the shady side of a hill, and yang shows a hill again, but the sun with its rays coming down, or the sunny side of a hill. If you like words, their English equivalents are yu bak and adret, but they represent the feminine and masculine principles. So the shady side is yin and the sunny side is yang. Remember how they work together with the mnemonic idiotic. Interdependent, intertransforming, interconsuming, and opposite. So male and female, light and dark, day and night, hot and cold, all make up pairs of yin and yang opposites. Interdependent, one can't exist without the other. They're intertransforming, so there is a cycle of transformation from one into the other. Also an extreme of yin develops into yang and vice versa. Interconsuming, so water extinguishes fire and fire evaporates water. Yin and yang was a way of understanding the interaction and wholeness of all things. You can use the principles of things like day and night, male and female, which are quite easy to study and understand, and use them to understand things like self and other and life and death, which are much more difficult to study. Kidneys are said to be the root of yin and yang in the body, so we'll use them as an example. So with kidney yin deficiency, the person becomes hot, so we get malar flush, afternoon feeling of heat, rapid pulse, red tongue. Dry, so we get dark scanty urination, thirst and sips, constipation, dry mouth and throat. And agitated, so we get agitation, restlessness, anxiety. With kidney yang deficient, the person becomes cold, so we get bright white complexion, cold and weak back and knees, feeling cold and tired. Get waterlogged, so clear abundant urination, no thirst, loose stools, edema of the legs, and we get flatness, so tiredness, lethargy, apathy, lassitude, slow pulse, pale tongue, poor appetite and loose stools. So these are ways in which we use yin and yang in Chinese medicine. There's also yin and yang collapse, which is seen at the end of life. When somebody's near to death, you see yin and yang separating, and this is an idea of how these things separate. Exterior and interior, Biao and Li, the characters show the outside of a coat and the inside or lining of a coat. So notice, just like with the same mountain, we have the same coat but a different aspect of it. Exterior represents the skin, so we see acute rashes like urticaria or measles. A lot of chronic rashes come from the interior. The exterior is the muscles, so we see sprains, strains, bruises as being on the exterior. The interstices, the chole, the space between the skin and the muscles, where invasions happen. So this is where we see acute wind invasions like the head cold, flu, allergies, abnormal sweating and fevers. This is where sweating happens. The channels, so B syndrome. This is when pathogenic factors get lodged in the joints. So depending on which pathogenic factor it is, we can get moving pains with wind, fixed achy heavy pains with damp, painful restriction with cold, swelling and heat with heat. And it can also affect the upper orifices, so things like earaches, mouth and tongue ulcers, conjunctivitis can be seen as exterior problems. Interior represents everything else, so organ deficiency, this can be any of the organs, and it can be qi, yang, blood, yin, body fluids, or jing. Pathogens in the organs, so this can be heat, damp, cold, dryness, wind, or phlegm and fire. Stagnation in the organs of qi or blood, and jing or marrow deficiency are all interior problems. Pathogens can be lodged between the interior and the exterior, and they can become lingering pathogenic factors seen at the Xiaoyang level. So we see this in conditions like ME and malaria and recurrent infections. Pair is Shu and Shi, which are empty and full. Shu shows a tiger and a hill. So a hill with a tiger on it, something that's empty or barren and hence unoccupied. Shi shows a roof with strings of money and precious shells, so it was originally wealthy and hence full or replete, substantial. A full condition is one where the pathogenic factor is present and strong, and the zhengqi is strong, so therefore the fight between the two is strong and you get strong symptoms. An empty condition is one where there isn't a pathogenic factor, but the zhengqi or upright qi is weak. And a mixed condition, which represents most of what we see in the clinic, is when there is a pathogenic factor present and the zhengqi is weak. So we need to work out at what percentage is the pathogen and what percentage is the zhengqi being worked. And a pathogenic factor here can be external or internal. It can be wind, heat, damp, cold, dryness, or it can be fire, phlegm, or stagnation. All conditions tend to be acute with strong symptoms, whereas empty conditions are chronic with weak symptoms. Full symptoms tend to be strong and sharp pains that are worse with pressure, whereas empty symptoms are dull and lingering and they're better with pressure. Full constitutions tend to be strong, sturdy, robust with a loud voice and strong presence. The breathing tends to be coarse, sweating tends to be profuse, and they're restless with bursts of temper. Whereas empty types are the opposite. They tend to be weak, frail and thin, tend to have weaker voices and weaker presences, shortness of breath, slight sweating, and tend to be inert or tired. So I use this extensively when diagnosing very young babies and children, where the diagnosis is much harder to make in terms of questioning. Deficiency is mostly qi deficiency, which develops into yang deficiency, and blood deficiency, which develops into yin deficiency. You can pause and read this, but I'm not going to go over it here. Conditions manifest in a number of ways. The most common is just a mixture of emptiness and fullness. So for example, we might have liver blood deficiency and blood stagnation in a lot of menstrual problems. We might have kidney yang deficiency deficient plus local qi stagnation, fullness in recurrent backache. We might have heart yang deficiency and emptiness with heart blood stagnation of fullness in cardiac disease. So we need to just unpick which of these to treat first, how to treat them together when we're using full and empty. The second way these manifest is an emptiness leading to a fullness. So for example, if there's kidney yin deficiency, an emptiness, the liver yang can easily rise up, a fullness. This is commonly seen in migraines. Spleen qi deficiency and emptiness can develop into damp and phlegm, a fullness, and we get digestive problems. You also get fullness leading to emptiness, so a full condition like a wind cold invasion. If they keep coming, get repeated invasions, we become lung qi deficient and emptiness, and we get a mixed condition. In the same way, long-term heat can consume the yin. And finally, true fullness, false emptiness, true emptiness, false fullness. So for example, somebody who's very liver chi stagnant can manifest as having low energy and a flat mood, seeming like very deficient symptoms, but actually it's because their chi is blocked. This is a bit like if there's not enough vehicles on the roads to get people around, then people can't get where they're needed. The chi can't get where it's needed. If there are too many vehicles on the road, also people can't get where they need to be. So the chi, if there's chi is very deficient, we get the same signs as if the chi is very blocked. Cold and heat. So the character for cold has a roof, a man that's brought grass into his house to stave off ice. And the character for heat has somebody holding something over fire. So these are the flames of fire. It can be full heat, a relative excess of yang or an external pathogenic factor that gets added on, or it can be empty heat where we get a relative deficiency of yin, and so the heat manifests. Likewise with cold, we can have an excess of cold, excess of yin, or an invasion of cold, or we can have a relative deficiency of yang, which manifests these empty cold symptoms. Expect with full heat you get stronger symptoms, so whole face red, thirst with gulping fluids. With empty heat you get small, weak heat signs, so malar flush, and thirst with sipping fluids. So a fever, high fever versus a low grade afternoon fever, profuse sweating versus night sweating, agitated, restless versus anxious and fidgety. With full cold and empty cold, so you get lots of symptoms in common. With full cold you get bright white face, empty cold a sallow white face. With full cold you get sharp contracting pains that are worse with pressure. With empty cold you get dull pains that are better with pressure. Loose stools that are better with a bowel movement versus loose stools that are worse with a bowel movement. Again, we might see one or the other of these, or it might be fairly neutral, or we might see a combination. So heat and cold combined, if we've got kidney yang deficiency, empty cold, combined with damp heat. You might see that in chronic bladder infections. Heart yang deficiency, cold, with liver heat. You might see this in someone who's tired, stressed, run down. You also get a situation where the external and internal are different. So if you've got somebody who has external heat, liver chi stagnation heat, but contracts an external wind cold, then you have the external and internal different. You can have heat above and cold below. Heat tends to rise, cold tends to sink. So we see this, for example, with kidney chi not receiving the kidney not receiving the chi, kidney yang deficiency, which is a coldness, and phlegm heat in the chest. We see this a lot with asthma. And we also get true cold, false heat, and true heat, false cold. Remember that an extreme of yin turns into yang, and an extreme of yang turns into yin. So we often get a manifestation of false symptoms along with some true ones. So look for the tongue to show you the true condition in these times. Thanks for listening. Here's some references and further reading, and thanks to the artists